You're watching Global Toronto. This is Global News at 5:30.
Thank you for joining us. I'm Alan Carter.
And I'm Farah Nasser. Imagine suffering from a life-threatening illness but denied OHIP coverage for the very drug that could make all the difference.
That is the heartbreaking dilemma one GTA family is facing tonight. Tom Hayes with our top story.
For 21 years in and out of hospitals, the journey has always been about getting closer to the miracle drug.
It's been long and it's been exhausting. It's been almost 2 years now.
Tori Lacey was born with SMA, spinal muscular atrophy, a crippling disease that slowly eats away at muscle function. The family has spent years fundraising, hoping for a breakthrough, and now it's here. It's called Spinraza, a drug approved by Health Canada, a drug Tori has been told she's not allowed to get in Ontario.
So if you have SMA, we're actually there and we have a treatment available. To me, it makes it that much more frustrating that we can't access it.
So just how many patients need access? Well, in Ontario, there's only about 100 SMA patients and most are covered by OHIP. About 30, including Tori, are being left behind.
I know it's very difficult for many families. I have heard from many people about this.
Health Minister Christine Elliott says more proof of effectiveness is needed to cover the rest of Ontario's SMA patients, even though just next door, Quebec has decided every SMA patient will be treated.
If it is proven to be highly effective, then the question will come back to CADTH to approve it at different levels.
But now there's hope. There's something that my friends in Quebec are accessing. There's something that my friends in New York are accessing, and I know that there is something that could save me, but nobody wants me to have access to it.
Tori's friends have told her that Spinraza has stopped the progression of SMA. Some tell her they have actually regained muscle function. The family fears further approval in Ontario could take years. For Tori, the clock is ticking now.
For us to wait another 3 years for the government to come to terms with paying for it, there won't be anything left to preserve for her.
This is difficult to fathom. First of all, how much money it costs, but also that this family raised money to develop this drug?
Right. It doesn't seem Ontario, does it? I mean, the miracle drug is there. You think we get access to it. They've raised over $1 million for the research in this drug, and they still can't get their hands on it. So what do? It's your child, right? So what about going it alone? What about paying for it yourself? Well, take a look at this graphic here. This is the drug we're talking about, Spinraza. And what about paying for it yourself? The cost, $118,000 per dose. Tori needs 4 doses a year for the rest of her life, and that is our story tomorrow.
Thank you, Tom.
It's an attempt to be heard, an attempt to save her life.
It hurts to have to fight for my life.
We met Tori Lacey a few weeks ago. She was born with spinal muscular atrophy, a rare disease that slowly eats away at muscle function until one day you can't breathe. There is now a miracle drug available, but not for Tori and not for Rebecca, who also suffers from SMA.
It's a miracle drug. It is a life preserver for the people drowning in this vicious disease.
The drug is Spinraza, and it costs $125,000 per dose. Each patient needs 6 doses in the first year. The Lacey family has remortgaged and gone it alone.
So far, we have personally spent $480,000 to fund this drug. Her 4th injection is scheduled on Wednesday, and then our family will be out of money.
SMA families have fundraised millions in hopes that a miracle drug would be discovered, and it was. It was approved by Health Canada, but who gets it in Ontario is limited. That is not the case in other jurisdictions. Saskatchewan, Quebec, and 47 other countries fund Spinraza for all SMA patients. That is the toughest part for Ontario SMA families to understand.
I want to shame both the government and the pharmaceutical company to sit down and start negotiating to find a way to get this medication to the people that need it.
We reached out to the Office of Health Minister Christine Elliott and got this response. Expansion of coverage for other Spinraza patients is actively under review. The toughest hurdle for these families is getting attention on SMA from the media, the public, the government. The toughest part of today's press conference was watching a young Ontario woman beg for her life.
Christine Elliott, Suzanne McGurran, and all the other decision makers in Ontario, I am begging you, please let me have access to this treatment.
Tom Hayes, Global News.
These young SMA women were here yesterday begging for their life. They mentioned your name.
Global News goes right to the health minister for answers as families hoping for access to a life-saving drug bring their struggle to Queen's Park tonight. They're feeling more optimistic. We have that story just ahead.
You're watching Global Toronto. This is Global News at 5:30.
Thanks for joining us. I'm Farah Nasser. Alan Carter is away on assignment. We begin our newscast with renewed hope for those living with a life-threatening illness. Last night, if you watched, we brought you the story of a young woman who was denied funding for a promising new medication, a drug that could make all the difference. They pleaded for help from Queen's Park. Now, 24 hours later, the help they so desperately need, it could be a step closer. Tom Hayes has our top story tonight.
Queen's Park is starting to take notice of SMA families. A standing ovation today in the Ontario legislature for the Van Frazen family fighting to get access to a miracle drug for their daughter Rebecca. But the applause wasn't enough. The hope was to get face-to-face with the person in charge. That's Health Minister Christine Elliott, to ask her face-to-face why this miracle drug is not available for their daughter. Spinraza is the miracle drug to fight the deadly disease, spinal muscular atrophy. Saskatchewan and Quebec fully fund all SMA patients. Ontario restricts the drug. Rebecca and her friend Tori were at Queen's Park Monday begging for help. This day, Rebecca's parents got in front of the health minister looking for answers. What does Saskatchewan and Quebec know that Ontario does not know?
Well, we have a process that we have to follow in Ontario. I think people expect that. We have to be responsible for taxpayers' dollars, but we also want to help families that need help.
Spinraza costs $125,000 per dose, and patients need 6 doses in the first year. Tori's family has gone it alone and has already spent close to $500,000 to save their daughter's life. These young SMA women were here yesterday begging for their life. They mentioned your name specifically. They need this drug to live. What do you say to them?
I say that I want to work with them and see whatever we can do to help them get access to the medication.
From there, Rebecca's parents got a private meeting with the health minister and came out with what they called hope.
So she's going to do everything she can.
Do you feel comfortable with that?
Yes.
Why? Why is today different?
I think it would be hard to look somebody in the eye and give them that kind of promise and not follow through with it.
The minister said she'll have an answer about fully funding for SMA patients within 2 weeks, a lot quicker than it took to get to the minister.
We've been waiting 2.5 years for this moment.
At Queen's Park, Tom Hayes, Global News.
This is Global Toronto. Global News at 6 starts right now.
The provincial government has approved funding for a life-saving drug, but the good news comes with a catch.
That is, if you are over the age of 18, you might be out of luck. Tom Hayes joins us now with the latest on this story he's been working on for some time. Tom.
Yes, it's been quite a while we've been working on this, following the fight for access to a miracle drug for those who suffer from the deadly rare disease spinal muscular atrophy. Today, some good news, but not for everyone. There is expanded help coming for SMA patients, but not for the ones who have led the fight.
Not exactly the news Tori was hoping for.
I was hoping that it would be all ages, all types, just like Quebec is doing. There's no reason why they shouldn't be.
Tori Lacey's story and the fight for her life have been well documented. She suffers from spinal muscular atrophy, a rare disease that eats away at muscle mass until the patient can't breathe. SMA families for years have raised millions in the hope of finding a miracle drug. That drug is Spinraza, but it was restricted in Ontario. Today, the health minister announced expanded coverage for Ontario SMA patients up to age 18. Tori is 21.
I'm only 21. I have my whole life and my whole career ahead of me.
So do you understand the 18-year-old cutoff at all?
No, I have no idea where the age 18 came from. I really don't.
Quebec, Saskatchewan, and 47 other countries cover the cost for all SMA patients. Spinraza is expensive, $118,000 per dose. Tori's family has gone it alone. 4 doses so far at a cost of almost $500,000. Tori agrees it is a miracle drug.
My breathing has definitely improved. I'm able to stay off my nighttime ventilator for longer, which I've never been able to do before. I've had increased energy and stamina.
At Queen's Park last week, Tori and 19-year-old SMA patient Rebecca Van Frazen begged for their lives.
I am begging you.
And that fight continues today. Tori is type 2 SMA, and her hope going forward lies on one small sentence in the health minister's announcement today. It reads, additionally, other patients with type 2 and 3 SMA may be considered on a case-by-case basis.
You'll obviously be applying for that over 18.
Yes, absolutely. I'll be applying right away.
Tom Hayes, Global News.
Now, I just got off the phone with Rebecca's mom, Teresa Van Frazen. She's calling this a victory. She says she's encouraged, even though her daughter missed the 18-year-old cutoff by 1 year. She's hopeful that Rebecca and Tori will be successful with their case-by-case application. I'm Tom Hayes. Alan, I'll send it back to you.
A Global News follow-up now. After a lengthy fight, the province has recently agreed to cover the cost of a life-changing drug for Tori Lacey, who suffers from spinal muscular atrophy. Tom Hayes has more on how that decision will change the life of the 21-year-old.
Check, check, 1, 2.
Your voice sounds way stronger.
It's been a while since this kind of smile and this kind of hug.
Just like this huge 200-pound weight had been lifted off her shoulder.
I know that I'm going to get stronger and not weaker.
The news has settled in. Fully funded access to the drug Spinraza to fight Tori's spinal muscular atrophy. But her mom says there's new excitement every day, watching her 21-year-old daughter get better.
And we've certainly been seeing the increase in strength.
I'm able to work 8 hours a day, which I've never been able to do before. I've definitely noticed a little bit increased movement in my hands.
Back in June, Tori, who was diagnosed with the rare fatal disease as a baby, was at Queen's Park pleading for her life. The focus was on Health Minister Christine Elliott, who was telling Ontario SMA families that the province was reviewing the drug, even though Quebec and Saskatchewan had already given full access to Spinraza.
I was still sitting there at Queen's Park begging for my life, and I'm just so thankful that that worked.
The process has paid off. Tori has been given a year's access to Spinraza, fully funded by the province. Tori's progress will be assessed after that. The family had already paid for 4 treatments, costing them over $400,000, money that was raised after selling assets and remortgaging their property. The hope is that some of that money can be refunded, but if not, going forward, looks just fine.
We hope that we can get reimbursed, but it was the fact that so many people are going to be approved for this. Of the efforts of many families that have advocated on behalf of this, it is definitely worth it.
Future looks good here, too.
I'm looking forward to graduating university. I'm looking forward to starting my career. I'm looking forward to continuing to travel the world.
Tom Hayes, Global News.